Thank you. Good afternoon, everyone. My name is Melissa Pearson, and I am the project coordinator with FREDLA. I am thrilled to welcome you all to today's webinar titled, What is Accreditation and Do Family-Run Organizations Need It? This is the first webinar in a two-part series on this important topic. The second webinar will be taking place on October 3rd. This webinar is being provided today as a technical assistance opportunity as a part of the TA network. The TA network is a partnership with 3 other universities and 7 organizations you see listed here. The TA network provides technical assistance to the Child, Adolescent, and Family branch of SAMHSA's Center for Mental Health Services and to grantees of the Children's Mental Health Initiative across the nation to support states and communities to expand and sustain their systems of care for children, youth, and young adults and their families. The Family-Run Executive Director Leadership Association, or FREDLA, is a new national organization focused on building the leadership and organizational capacity of family-run organizations. FREDLA, incorporated in 2013, was started by executive directors of 16 family-run organizations who recognized the need for a peer-led organization whose focus was on enhancing, expanding, and elevating family-run organizations as an industry. As a result, FREDLA was born. FREDLA's mission is to strengthen the leadership and organizational capacity of family-run organizations whose focus is on the well-being of children and youth with mental health, emotional, or behavioral challenges and their families. FREDLA provides technical assistance to system of care grantees in the form of webinars, topic-specific consultation, site visits, resource materials, leadership camps, and much more. FREDLA is excited that you have chosen to join us today to hear about the timely topic of accreditation and what it means for family-run organizations. Today's webinar will be led by Millie Sweeney. Millie is the principal partner of Family Solutions Consulting and contracted by FREDLA for this project. We hope you enjoy. Millie?
Thank you, Melissa. Welcome, everyone. As Melissa said, today's webinar is part 1 of a 2-part series on accreditation. We're going to have an overview of accreditation, followed by a presentation from Clark Griffith on the process of accreditation through the Council on Accreditation. We'll then hear from Paul Cornell of the Alaska Youth and Family Network about his organization's experience in the accreditation process. There will be a question and answer period following Paul's presentation. As Adam said, if you would just type your questions into the Q&A section, and we will keep up with those and answer those toward the end. So what is accreditation? Accreditation means an accrediting agency has determined that an organization has met specific requirements and standards in the organization's field of services. In this case, we're referring to mental health. An accrediting agency refers to an agency which has developed clinical, financial, and organizational standards for the operation of a provider of mental health services and which evaluates an organization's compliance with its established standards on a regularly scheduled basis. Additionally, there are states that have their own accreditation processes and some states that require accreditation through a national or international agency. The terms accreditation and certification are sometimes used interchangeably. However, they are not synonymous. Accreditation is the stamp of approval from a third-party review of an agency's operations and infrastructure. Accreditation applies to an organization. It's a third-party review of how the organization is operating in their infrastructure for specific services. It refers to an agency's practices in the areas of finance, personnel credentials, service structure, and policies and procedures. Certification, on the other hand, is used for verifying that personnel have adequate credentials to practice certain disciplines. It is a comprehensive evaluation of a skill, typically measured against some existing norm or standard. Certification is the verification that a candidate has successfully completed an evaluation of his or her knowledge, skills, and abilities against a specific standard. Individuals that provide appropriate documentation of their experience and expertise and successfully pass a certification exam are certified. Industry or trade associations will often create certification programs to test and evaluate the skills of those performing services. There is definite value in being an accredited organization. Accreditation focuses on quality and performance of an organization. It offers value at several levels to an organization. At the personnel level, assists in improving quality and meeting national standards in the service field. For payers and funders, they recognize that an organization is accountable and a good steward of the funds they provide. For states, it signals that an organization is structurally sound and committed to improving quality services to the targeted population. And for the public, consumers and families, as well as the community at large, are aware that the organization strives to provide high-quality services and support. The question today is, do family-run organizations need to be accredited? And this differs from state to state. Some states or state agencies are beginning to require that accreditation is in place for contracting. There's a changing marketplace dynamics that necessitate changes in your business strategy to address competition in funding and to be competitive for other things. For example, Medicaid plans require a process to ensure providers and provider organizations are properly credentialed to provide specific services. Although states differ on behavioral health policies and regulations, accreditation does offer a uniform set of standards and expected organizational behaviors. In an environment where funding is scarce and funders are being pressured to demonstrate sound fiscal decisions tied to outcomes when they provide dollars, accreditation becomes an important factor and one that we should explore and consider. However, family-run organizations are not traditional mental health facilities and tend to have differing structures, are mission-based, and place high value on lived experience rather than educational credentials. Accreditation processes are from a more clinical medical model of service delivery, so becoming accredited can present some unique opportunities and challenges to family-run organizations. Let's look for a moment at the potential benefits and considerations of undertaking the process of becoming accredited. As a family-run organization, there are benefits to becoming accredited. There's recognized value among funders, other providers. It gives you a competitive edge for funding opportunities. There's public confidence in the services and organizational structure when an organization is accredited. It offers the opportunity to strengthen processes and procedures internally, and it's a visible demonstration of the organization's commitment to quality. There are also some things to consider as you explore the possibility of accreditation. Standards for programming and staff are typically more clinically driven. Personnel training, education, credentials are different in family-run organizations than your traditional mental health center. Lack of standards for non-traditional services typically provided by family-run organizations can make it difficult to fit into the standard areas in accreditation. And then there are costs to accreditation, both monetary and time. There are several accrediting bodies in our field. There are state accreditations, there's national accreditation, including the Joint Commission, the Accreditation Commission for Healthcare, also known as ACHC, the Commission on the Accreditation of Rehabilitation Facilities, also known as CARF, and the Council on Accreditation, also known as COA. To better inform you of the world of accreditation, this webinar series will focus on the two most likely accreditations for family-run organizations, COA and CARF, as they focus more on community-based services, most closely related to the work of family-run organizations. Today we'll hear from Clark Griffith from COA, and in part 2 of the webinar, which occurs on October 3rd, we'll focus on CARF accreditation. Now I'd like to welcome Clark Griffith. Director of Training and Technical Assistance for the Council on Accreditation, also known as COA. He'll provide an introduction to the COA process, the supports offered to organizations as they become accredited, and the basic cost of becoming COA accredited. Clark?
Thank you, Millie, and thank you to everyone for joining the call today. My team is responsible for providing training and tools for our organizations and agencies going through the accreditation process, as well as for the volunteers who conduct our site visits, which I'll be covering shortly. I'm joined by Sabrina Harris from our Standards Department.
Hello, everyone.
And Sabrina will be here to answer any specific questions that you might have about our standards and specifically our service standards. So in our time today, my hope is that you'll leave with a general understanding of who we are, the benefits of becoming accredited, some of which Millie started us off with, the cost of accreditation. We'll talk about the overall process and major milestones, and how COA supports you throughout the accreditation cycle. So let's start with a little background on COA. I'm going to use my pointer here. Okay, the Council on Accreditation is an international, independent, nonprofit, human service accrediting organization. It was founded in 1977 by the Child Welfare League of America and Family Service America, now known as the Alliance for Children and Families. Within a few years, COA expanded beyond its child welfare roots to become an accreditor of the full range of community-based social service and behavioral health care programs. And currently, COA accredits or is in the process of accrediting more than 1,800 private and public organizations that serve more than 7 million individuals and families each year. And next, I'd like to talk about some of the unique characteristics of COA accreditation. So first, we like to think of this as an open and collaborative process. Arrow over there. Our role is to partner with you and assist you through the entire process, start to finish. And our accreditation lasts for 4 years. That's the length of the accreditation cycle. And it's important to note that all programs and services will be reviewed and must come through the process. For example, you can't get your case management programs accredited and not your group homes. So we accredit the entire organization as long as we have service standards that meet those programs. The accreditation process is an excellent opportunity for members of your staff to work as a team, conduct a self-assessment, identify areas for improvement, and implement nationally recognized best practices. I'd like to think of it as like holding up a mirror to the organization for some self-reflection. Typically, the time it takes to complete the accreditation process is between 14 to 18 months. That's from the point of intake to the point that an accreditation decision has been made. The length of time depends on the size and readiness of your organization or program. So it's really important to be aware of the time frame when planning for the accreditation process. Another unique feature is that our standards and significant accreditation materials are free. They're available to anybody who wants to look at them through our public website, which is coanet.org. We have a lot of tools, a lot of training that's out there. The vast majority of those resources are free and available through our public site. We like to think of COA accreditation as an open book test during which you know what the questions are and you're given all the answers. And once you dig deeper into the process and look at the standards, you'll see that there's really no secret here. We give you everything you need free of charge in most cases. And one of the things that we're most proud of is, and this kind of ties into my first point in the upper left about open, facilitative, and collaborative, is that you're assigned a dedicated COA coordinator to support you throughout the entire process, and we'll talk about that role a little bit more. So you might ask yourself, how does accreditation benefit you, your organization, and your key stakeholders? Millie did hit on some of these points, but we'll we'll go through this list. There really are many benefits of going through the process and becoming accredited with COA. A major benefit is what you'll gain by undergoing that in-depth self-evaluation, that holding up of the mirror that I just talked about, and having our experienced volunteer peer reviewers assess your practices against our standards. The accreditation process provides you an opportunity to do a thorough review of your existing policies and procedures to determine what needs to be updated, what new policies and procedures are needed, and whether the policies and procedures are being followed. And that last point is really important. It's one thing to have a policy, but it's something more, obviously. The policy really only has value if it's been implemented and part of regular day-to-day practice. Being part of the accreditation process can be a very positive team-building experience that develops valuable skills and knowledge in your staff that they can use and apply in their current role or probably the rest of their careers. COA accreditation exposes you to national management and operational benchmarks that, once implemented, lead to improved service to those you provide service to. And COA accreditation strengthens your organization or program by helping you build infrastructure, implement quality improvement processes, and adopt nationally recognized best practices. And the result of all that is the provision of higher quality programs and positive client outcomes. So as a result of the accreditation experience, your organization now has a sustainable framework to use to establish an ongoing review of performance. And as we'll discuss a little bit later, another potential benefit of COA accreditation is that you might qualify for financial reimbursements or other benefits as part of what we call COA recognition that varies depending on what state you reside in. So I just mentioned at the top here about the validation of your organization by an outside entity, and we're referring to our COA reviewers there. And this slide talks about the criteria to become a COA reviewer, which I thought was important to emphasize. These are highly qualified professionals. They need to be affiliated with a COA accredited organization. In order to become a COA reviewer, they must have a graduate degree in a human service discipline or have service management experience. They need at least 7 years of continuing management experience, and this should ideally include experience in budgeting, quality improvement, governance, or other administrative responsibilities. And they must have at least 5 COA service areas that they're experienced in. And our reviewers are chosen based on their experience with the specific services that your organizations are providing. So COA accreditation can be thought of as one of the 3 key legs in establishing a system of accountability, shown through the symbol of this stool here. In the world of social services, these three elements, licensing and government oversight, professional credentialing, and accreditation, work together and complement each other rather than being duplicative of each other. Licensing is conducted by a state or federal agency. Credentialing is specific to the workers and their professional training and certifications. And accreditation is what the organization as a whole achieves. A person gets credentialed, an organization gets accredited, as Millie was mentioning a few minutes ago. So these 3 combined are the checks and balances to ensure agencies are succeeding in their missions and that clients are protected and getting quality, safe service. So COA has several business lines we accredit, which are listed on this slide. Most, if not all of you, would fall under private organizations, so you would use the private version of our standards. For more detail on the different programs COA accredits, you can visit the Programs tab at coanet.org. Just wanted to give you that overview so you can see the other types of programs that we do accredit. We have standards for nearly 60 different services. When you go to our website, the services are listed alphabetically, but this slide and the next one organize the programs and service we accredit by population, like child and family services, mental health services, substance abuse, and on the next page, aging services, homeless services, and services for people with developmental disabilities.
And peer support services can fall under a number of our different service areas. Oftentimes we see these programs come under our counseling support and education services standards, where we cover non-clinical counseling and support and education groups. We also sometimes see these programs come under our outpatient mental health or our services for substance use conditions service standards.
And again, all of those specific service standards are available on our public site at coanet.org. So next I wanted to draw some distinctions between COA accreditation and CARF accreditation, which I know you'll be learning more about. As I mentioned earlier, COA accredits the entire organization, meaning all programs for which we have an applicable service standard have to go through the process. CARF offers programmatic accreditation, so they are accrediting at the program level. With COA, our process is very facilitative. You have a dedicated COA coordinator to see you through the entire process. You're given numerous opportunities to demonstrate implementation of our standards, and we provide you with numerous free tools and trainings. Our accreditation lasts for 4 years versus 3 years, which is the length of accreditation for CARF accreditation. CARF makes an accreditation decision right after the site visit, either a full-year accreditation or a 1-year temporary accreditation. With CARF, if you're not ready to be awarded a full year, they award you that 1-year temporary accreditation, which means that they would be coming back a year later to do another site visit, and the organization has to pay the accreditation fees again. With COA, it's either you either become accredited or you don't, but we really support you along the way so that you do become accredited. And so there's only one type of accreditation, and that's for the full 4-year period. With COA, once the site visit has taken place, we send out what we call a PCR report, which is the pre-commission review report. And that identifies any additional documentation or information that we need to see in order to make sure that you're meeting those standards. So it's just that between the self-study and the site visit, there were still some outstanding information and documentation that we needed. So you're given that additional opportunity to provide that documentation. For a more complete comparison, you can visit coanet.org and enter CARF into the tool search on our site, and that immediately you'll come up with a very comprehensive comparison between our two different approaches to accreditation. So now that we've talked about COA generally, I'd like to describe the accreditation process in more detail. So the process involves 7 steps. First off, you'll submit an application, and once that is processed, you will sign an agreement and pay your fee. So we're right up here at the top. Then you are considered in process, and you will move into the intake phase, where you will complete critical online forms and be introduced to your COA coordinator, who will match your programs to COA standards based on the online forms you've provided. Your coordinator will schedule key milestones like your self-study date, due date, and your site visit. So the self-study is really where you'll spend the bulk of your time, probably about 8 to 10 months. You provide documentation through your private MyCOA portal that demonstrates you are meeting our standards. And in your portal, you have a table of evidence which lists exactly what type of documentation you need to provide for each standard. So then the site visit typically lasts for 2 to 3 days and includes a minimum of 2 to 3 peers, including a team leader, depending on how large you are and how many services you have and your number of locations. Following the site visit, the peers will submit their ratings, and you will receive a pre-commission review report, the one I was just mentioning, that lets you know if there are any standards that require further explanation or documentation before you can become accredited. So once you provide that additional requested evidence, you'll receive your accreditation decision and a report with all of your ratings. And that's the accreditation decision, step 6. And once you're accredited, you'll move into the maintenance of accreditation phase, where you'll provide annual documentation until your next cycle begins. So there's 3 years where you're in between cycles where you're providing that documentation. So as you can see, this is a process, it's a cycle, and our hope is that after you've been accredited and you've gone through your first 4 years, you'll see the value that it's had to your organization and to your stakeholders, and you'll consider going through the process again. So here's a chart with the most significant events and timelines, or I should say milestones, in the course of the accreditation cycle. The ones in blue include your intake call, your self-study due date, your site visit, and the point when you receive your accreditation decision. So we definitely encourage you to read this on your own and learn about the process, but this gives you a sense of the timing of each of these events. So we just went through the process at a really high level, and for more detail, we highly recommend that you review our accreditation guidelines. They're available on every page of the standards. There's a link to them, and you can see this is a screenshot of our public site. If you click on the Standards tab, you'll see the accreditation guidelines link on every page of the standards. The guidelines cover every major phase of the process. It explains the structure of the standards and outlines COA's system for rating the standards. And the guidelines include links to recommended resources and tools. And we highly recommend that every member of your accreditation team review the document and keep it handy for reference. It's about 20-some pages. We just did an update that was just released yesterday, I should say. So it's really something that we encourage every person involved in the process to read, so they understand every major event that occurs and how our process works. The next slide just kind of shows the first page of that, so you can see, the guidelines provide an overview. It gets into detail about the self-study process. It talks about the standards. So it's really a great reference point. So let's talk about the cost of accreditation. The application fee is only paid for your first cycle of accreditation. That's $750. The accreditation fee itself is set on a sliding scale based on your organization's annual revenue, and it starts at $67.20. This can be reduced by 25% if you are a member of a sponsoring organization, and I have a slide coming up that has a list of those sponsoring groups. The site visit fee assumes a minimum of 2 peer reviewers for 2 days, and the fee starts at $4,000. And then there is the annual cost for the maintenance of accreditation, which is $400 a year. So at a minimum, we're talking about a little over $11,000. But again, that's going to depend on your budget size. And Zoe Hutchinson, whose email I'll provide at the end of my section, is a great reference point for anyone who's exploring accreditation with COA. She can talk to you specifically about your programs and services and what your estimated fee might be. So that's a good segue to this slide. Zoe, again, is a great contact. If you want to look at more detail about these fees, you can click on the accreditation tab on our public site, and the fourth item is fee information. And I also mentioned about the 25% discount. If you're a member of one of these sponsoring organizations, that's a nice savings on your accreditation fee. So let's talk about the various ways that COA supports you throughout the entire accreditation process. Let's look at some of the resources on our website. In the first drop-down menu, the accreditation menu, you can see there's a lot of basic information about who we are, an overview of the accreditation process, how to apply, and what the eligibility criteria is. So that's a great place to start. At the bottom of the menu, you can click to view which organizations or programs are already accredited. So if you want to talk to somebody about their accreditation experiences, you can find organizations in your area or those that are similar to yours in size and services to reach out to ask questions. So I had mentioned the COA coordinator earlier, this person who's dedicated to you throughout the process. They're another incredibly valuable resource for you. They will be your single point of contact, and your organization or agency will be asked to designate a single point of contact on your end so that communications between both sides will be one-on-one throughout the process. I'm assuming that many of you on the call would be fulfilling that role. The coordinator will be able to answer your questions, guide you through the process, make recommendations, and point you to resources such as training and tools, and generally advise you about some of the important milestones and deadlines, including preparing for your self-study and preparing for your site visit. Your organization's point of contact will be emailed the COA learning plan once your agreement has been signed and you've paid your fee. The learning plan provides links to well-timed self-paced training, tools, and other resources based on where you are in the process. It assists you and your organization in learning the fundamentals of the process, teaches you about the COA standards, how to use the MyCOA portal, and much more. All the resources linked in this document are free. Our coordinators have told us the organizations taking advantage of the learning plan resources are likely to experience a more positive and productive accreditation process. So we did this in the last year because we have this great wealth of tools and trainings, but we felt that it would help people to have a better sense of when to use what if we package them in some type of a program. So that's what we've done with the learning plan, and we've gotten such a positive response to this. So the training and resources section of the website is where you can find many of the resources that I just mentioned that appear in the learning plan. You can search for trainings under the training calendar. You can search for tools under the tool search. It's just a great place to find a lot of different helpful resources. And then under the Standards tab is where you'll find links to the standards for our different lines of business. And as I mentioned before, the assumption is that most, if not all of you, would be reviewed under our private standards. So if you click on this link, you'll actually see the standards for private organizations. So this slide breaks down the major subcategories of our standards. And just let me preface this by saying I'm just going to spend a minute or two on a fairly vast topic. We have several trainings and resources that give an overview of our standards, which I highly encourage you to take advantage of. So this is just really kind of scratching the surface. So you see on the left, under Administration and Management Standards, we have standards about ethical practices, and those might include conflict of interest issues, fundraising, ethical fundraising practices, and other professional practices. Then we have financial management and governance addresses issues related to board and board functioning as well as executive functioning. And you can see as you go down the list, HR, PQI, performance and quality improvement, and risk prevention and management. Those comprise our administration and management standards. Network administration only applies to networks, and those are entities that don't actually provide direct service. Then we have our service delivery administration standards, and these are management practices, but they tend to take place at the program level. We call both these sets of standards, so everything on the left side are management standards. So all organizations and agencies are rated on the management standards on the left. That's what this green box says. The only exception is the network standards, which I mentioned only applies if you're actually a network. So where we really have distinctions, of course, and what's unique to your organization is with the service standards, because those will be assigned to you based on the programs and services you actually provide. So this box only shows the first 6 service standards we have, but we actually have, Sabrina, correct me if I'm wrong, I think we have 49 sections of standards, which can accredit approximately 130 distinct types of programs. So the administration and management standards, especially PQI, that's where most organizations need to focus attention and make improvements to meet our standards. Typically, the service standards are less of a challenge. It's really those administration and management standards, especially the performance and quality improvement. But again, your coordinator and our tools and resources can really provide you assistance in meeting the standards in those more challenging categories. So we've covered a lot of information in a short time frame, the overview of COA, the steps in our process, the cost, our resources to support you, and a very brief description of our standards. We'll have time for questions and answers at the end, so I'm happy to answer any questions that you might have, and you can always reach out to me even after the webinar. If you have questions specific to which service standards might apply to you and or questions about the fees, please contact Zoe Hutchinson, and she can help you in that regard. And Sabrina is also available to answer questions specific to the service standards. So thanks so much for your time, and I look forward to staying on the webinar and answering any questions you have toward the end.
Thank you, Clark and Sabrina, for sharing the COA process and for being available for questions after. Now I would like to introduce Paul Cornell. He's the Executive Director of the Alaska Youth and Family Network. AYFN is currently in the accreditation process, and Paul is going to share his experience and lessons learned thus far. Paul?
Hey everybody, I'm Paul Cornell. I'm the Executive Director of Alaska Youth and Family Network. I've been with our organization about 8 years, and in my position 3.5, and prior to being here at AYFN, I helped set up the first peer-run organization in our state that was a standalone, builds Medicaid. So I'm very familiar with good business practice and peer-run and family-run services, and I think that's going to be important to remember moving through. So AYFN is a statewide family organization. We currently have 17 employees statewide, and we will be expanding here before the first of the year. We'll be doubling in size. We chose accreditation for several reasons. One, we have a state requirement. This last 1.5 years, AYFN's category within our state's funding stream changed from kind of a general services category to community behavioral health, treatment, and recovery, which is the same category that all of our community behavioral health centers function under. So it means to continue getting our funding, we have to meet a different standard, and they're not generally the standards that family-run organizations are used to functioning under. They're much more formal and medically oriented, clinically based. So that was the primary reason that we decided to move toward accreditation. The other reason that we really chose to move forward with accreditation is because we're becoming more service-oriented here at AYFN. We started out as an organization that just provided the information referral, family support, education, advocacy, and then as the needs in our community changed and resources became more scarce here, we began providing more and more support to families. We provide a lot of case management and intensive case management now. About 50% of our families and the children that we serve are involved with juvenile justice or child welfare. So we do a lot of family preservation, reunification activities, crisis stabilization, and that requires a level of expertise that we didn't have here for a long time, and it means that we had to change our practice a little bit. We didn't really have guidelines for doing that and staying true to our family-run origins, which is where we are very much grounded. We are very much a family-run organization still. So the reasons that the benefits of becoming accredited, the first one is that it does provide a good framework for moving you forward to the next level. We're no longer a grassroots organization here. My board spends very little time in the organization volunteering and providing any direct support. Accreditation has already increased interest from funders for us. Just the fact that I can say when I'm speaking with a potential funder that we are moving forward with accreditation indicates to them that we have good fiscal practices and good business practices, and especially in our state right now, it's very important. Money's tight, and funders are really looking closely at how you're going to be, if you're going to be a good steward with those finances. It's also improved our relationship with our referral sources. There was a perception in our community that because we were a family run and we didn't adhere to typical behavioral health protocol in our community, the community behavioral health standard, that we were that group of individuals, the families that got together to help other families, and we weren't really behavioral health providers. It made collaborative relationships, especially once we started providing more behavioral health oriented services, difficult. And now that we're putting standards in place, especially with child welfare, things have leveled off a lot more. Our relationship is a lot better. From a business standpoint, it's helped us standardize our practice. We had a lot of really good practice here. We just had a state site review this spring, and on a 100-point scale, we scored 100 points. So we have good practice in place already, but it was kind of free-form. We developed things when we needed to develop them, and we used them when we felt like we needed to use them. And COA puts a structure in place, accreditation puts a structure in place for us so that we have to adhere to good practice all of the time. And it provides incentive for us to do that. It also forced my board, which was a very good thing, to look at their role within the organization. My board, like a lot of family-run boards, is very interested in programming and the service that we provided to the families that we serve and the youth that we serve, and not so much in the actual governance of the organization. If our spreadsheet, if our financials were black on the bottom of the sheet, they were good. And now that we're moving forward with the accreditation process, they're becoming much more governance-oriented. They're very interested in the fiscal management here now. They're working on a business plan. We're working on a strategic plan. These are all things that we didn't have before. And they didn't see before accreditation, our board didn't see the importance of having those things in place. Accreditation, I think, is going to position us to survive well in the long term. Just the increased support from our community partners and our funders that we're getting now, before we're even fully accredited, is a really good indicator of the value of becoming accredited, especially for an organization in our community. We're the only family run in the entire state, and it's really hard sometimes for the community to understand what we do. And accreditation indicates to the community and to potential funders that we are professional, that we do maintain standards here, that we're not just a flash in the pan. Like I said earlier, it requires that there's a lot more involvement from your board. They have to learn a lot of new things, and that's been both good and bad here. It has presented a lot of challenges at times for us just to get to the point where my board decided that we were going to become accredited. That discussion was almost a year long because it does impact the way we function here, the way we look. We're looking less like a typical family run and more like the community mental health center in a lot of ways, and we're operating that way. And our board was resistant to the formality of the process. So the thing that I like most about COA is that all of their standards are accessible online. We didn't have to give them any money up front. There was no payment required. And as we were working on this process with the board to get good with having to become accredited, I had access to all of the standards. We could discuss them, and we did discuss them quite a bit, especially the governance standards, and talk about those pros and cons. There are, just like the previous presenter said, there are more than enough resources on the COA website to help you get through this process, and they're really good resources. COA here has really, the accreditation process has been overall, I told Millie yesterday, it's a love-hate thing with me, but I think for the organization, it's the best choice. It's the best choice for long-term survival for us. It's the best choice to help us grow in a structured, intentful way, and I think moving forward it'll make us a much better family-run organization. So the challenges of becoming accredited, which are becoming more apparent for us as we're moving forward, like most family runs, we don't have, I wear 13, 14 different hats here probably, and I have I'm lucky enough to have a full-time operations manager, and I have a program supervisor, and it's the three of us. After our full-time jobs are done for the week, we're working on this COA accreditation ourselves. And it's a very labor-intensive process. And as we move forward, we have all these other things in the pan. We're a very busy office for our size. We serve, at any given time, we have 250 families here that we're working with. And so it's a very busy office, and finding the time and setting aside dedicated time to work on this process has been a challenge. Also, as we move forward, the morale of the staff is being affected. Our direct service staff, our family support providers and our youth support providers, they're experiencing a lot of change as we implement new policy and procedure and new practices. And the staff that's helping me do this work, it's a burden on them, and I appreciate the work that they're doing. After they work their regular work week, they're spending a considerable amount of time working on our accreditation process. Challenges for the board, it requires your board that they have the desire and the ability to achieve a new level of understanding. They have to become much more involved in the actual governance and oversight of the agency. During the year-long process that we went through to decide to move forward with accreditation, we lost 2 board members. We lost them specifically because they felt that becoming accredited was going to affect our family feel, that we wouldn't be the same organization that we were after accreditation. I absolutely agree with that. We won't be, but I think we'll be stronger and better positioned in the marketplace. To assist us with that transition, the difficulty in transition for our employees and for our board, we've actually hired a consultant to work on board development to help them understand all those things that they need to understand to be strong board members and help us move forward. We're also actively recruiting board members from a different subset of our population, and we're looking for more technically oriented, business-oriented board members. Our consultant also helps us with our direct service staff. He's doing a lot of training, helping them see the parallels between what was a very informal approach to service provision here and helping them fit into the structure that COA is requiring that we fit into. So the next thing to talk about is there is a difficulty fitting into the family model when we're implementing these standards. They're not exactly written for our organization. The closest standards I think for a typical family-run organization would be the Counseling, Support, and Education Program standards. And for our organization, that they weren't adequate because we do so much family preservation and work with DJJ and the OCS and some more technical case management. We had to implement 3 separate sets of program standards, and that's a challenge. They each have different education requirements. They don't recognize that the family run recognizes lived experience over formal academic education, and that when we're considering hiring a new family support partner, that having that formal education is value added, but it's not the criteria that we're considering here at AYFN as the primary screening tool and driver for employment. Our staff receives, probably 300 hours a year or more now of training. They're very well trained. They're some of the most well-trained providers, direct service providers in Alaska's system. So I have a really hard time with the education standards, especially for case management and counseling. Support and education is more flexible, but for case management and family preservation, they're pretty rigid. The programmatic standards are more clinically oriented and not, they don't recognize the uniqueness of the type of service that a family run provides, our approach to providing service. For AYFN, we have a unique set of a unique challenge here because we have a model where our family support provider will provide service across programs. And COA looks at each program as kind of a separate line of business, for lack of a better description. And they really do describe 3 really different types of providers in the program standards with different levels of education and training required. And that's a challenge for us because we don't have 3 separate programs. We don't have counseling, support, and education, and then a separate family preservation and case management program. We have one provider who serves a family from intake to the time they decide that they're done with us and their case is closed, and they provide all of those services. So that's been a challenge for us. But I'd say, again, overall, we did look very closely here at not only COA, but we looked at a lot of the other accrediting bodies, and for our organization, COA absolutely has been the best fit. I don't know if there's any questions. I would appreciate to be willing to take them. There's a lot more to this process than 20 minutes can cover.
Thank you, Paul. I think, well, there was a question about can the speaker speak up. I know that Paul just has finished his presentation. We are going to open this up for questions and answers. So if anyone has anything, they're welcome to type it in. We'll also open the phone lines in just a second. There is one question that I've heard a few times from people in family-run organizations that I wanted to ask Clark, particular to COA. With this being a potential new market, a growing market for accreditation, are you aware of any planning that's happening within COA to develop standards for family-run organizations or for family peer support services?
I'm actually going to have Sabrina answer that question.
And thank you for that question. I'm so glad that came up. One of the things that I'd like to let you all know is that currently COA is reviewing our behavioral health service standards. So included in that service array would be our outpatient mental health services, services for substance conditions, as well as our counseling support and education services. And as Paul was mentioning, our counseling support and education services are a little bit more, let's say, user-friendly to peer-run, family-run organizations. But we are noticing that this is a huge trend in the field, and it's just a growing evidence base for peer support programs. So we are looking at that in relation to our behavioral health standards and looking to see how those programs fit in with our behavioral health. And you know, it's some of the challenges that Paul addressed, particularly around the clinical aspects as well as the personnel standards, how they can sometimes pose as challenges to organizations. So that's something that is on our radar currently. We're actually right now working on revising and updating those standards. And then just, you know, kind of to speak to some of the personnel concerns with the standards, across our different service areas, we do have different personnel qualifications and requirements. One of the things we do try to do is we do try either in interpretations or the standards themselves, we do note that we view competency in a variety of ways. You know, while we do have education requirements, that's just kind of one way that we can evaluate competency. Some others are experience, whether that's professional experience or lived experience, as well as training and other credentialing. So all of that is considered, and the peers look at all of that when they're doing their ratings for the personnel standards. So hopefully that kind of can help with some of the hesitation and concerns around the personnel standards. But just in general, for peer support programs, it's something that we're seeing more and more of, and we're looking internally how better to meet the needs of programs that you all are working for.
Okay, thanks, Sabrina. Are there any questions about the steps in the accreditation process or about how standards are structured or developed from anyone? And Adam, if you could unmute people. Are there any questions about how accreditation decisions are made? with COA.
And Millie, if you don't mind, I'm going to jump in again. This is Sabrina from COA. I just wanted to kind of piggyback off of Clark's closing and let prospective organizations, or if you're interested in the accreditation process and you'd like to reach out to Zoe Hutchinson, if you also have questions related to our service standards, one of the things that we can do to help with the process and as you're trying to make this decision about accreditation is we offer initial service assignments. So that's a way where we can review your different programs. All the organization needs to do is provide a program description or just describe the services that are offered, and we can provide a preliminary match with our service standards. That way you can go online and view the standards before you kind of delve deep into the accreditation process. As Clark has all mentioned, all of our standards are available at our public website, coanet.org, for free. So it's a great way to kind of familiarize yourself with the standards and the expectations before you jump right into the accreditation process. So for anyone who is interested in learning more about the standards, I would highly encourage you to reach out to Zoe, and she can connect you with the standards department to help you match those services.
Thanks for that, Sabrina. Paul, you mentioned something when we were talking about it would be a good idea for people to look at those standards if they choose to become accredited or explore the possibility of that or not. There's very good best practice in there for business. And there's a question.
I'm not sure.
I'm sorry, Paul, go ahead.
Yeah, we did consider CARF accreditation, and at the time we were considering it, there were two things that caused my board to move the other direction. One was the standards weren't readily available to us. So when we were trying to evaluate what CARF exactly offered us and how they would benefit us, we couldn't look at their standards. We did talk to some other community providers that used CARF, but I think my board felt that the process, that COA's process, and the fact that they are very transparent, was an organization that had values more similar to their values. CARF was very, very hard for us to evaluate, and also CARF looks at, as Clark was saying in his presentation, COA requires that the entire organization and all the programs within the organization meet a standard, and CARF doesn't. And that was a very strong consideration, especially for our board president, who felt that if we were going to go through this process, that we shouldn't be able to pick and choose.
Okay, were there further questions for any of the presenters? Okay, well, I want to thank Paul and Clark and Sabrina and Melissa for being part of the webinar today. We do have a second part of this webinar that will focus on CARF coming up on October 3rd at the same time, and information will be going on about that. There is a question that just came across. I'm going to take a minute and read this one out. Our family-run organization is currently very similar to AYFN prior to moving to service-oriented. And the question is, if they stay the course of a family-run with peer education, advocacy, support, etc., is there a specific accreditation process for us as an organization? Also, if we have...
Yeah,
Go ahead.
there isn't. Yeah, from our experience, there isn't. The closest match currently within COA standards is the counseling, support, and education. But they're not, those standards aren't specifically geared toward family runs. And I think that they define service a little bit differently than most family runs do, and they'll force you to make some changes if you're going to meet them. Some of the changes are really good practice, and some of the changes require that your staff and me, I've had to take a different view of the world and get good with making some changes that maybe I wouldn't have made if we weren't considering COA. So there's some compromises that you have to consider.
So if a program only matches two of the three areas for accreditation, can they be accredited in 2 out of the 3? Or do they have to meet all?
And I can jump in and help with that question if you'd like. We do run across this with certain programs. The services that are offered don't fall within our service array, even though we have a lot of different services and sets of standards. For that, when that happens, we can accredit a program under our administration management and service delivery administration. So those first 2 management sections that Clark went over that are applicable to all organizations, we can apply those standards to your organization. And then for your specific program, since it doesn't fit within our service standards, we have what we call a generic service supplement. And it's basically where you can give a program description and some more in-depth information about the program, but your organization can still come through the accreditation process, just not under a specific service area.
Then there was a question about the type of changes that had to be made to the parent support services delivery, if any, as you're going through accreditation. And that's for you, Paul.
So because of the type of service that we're providing here now, which is more of a hybrid of typical community behavioral health services, case management, I said the family support and preservation, crisis stabilization, and then the role of the family support partner, which is the education support advocacy. We haven't made any specific changes yet to the family support partner piece, to the peer navigation piece, that's what we call it. But we will have to, if we can't figure out a way to work with COA to blend these programs, we are going to have, I can see in the near future, we're going to have to change some of our practice. And it may mean that we have to hire staff specifically for certain aspects of, like, say, family preservation and stabilization, instead of using one dedicated family support partner to do that.
So it's one of those things to consider.
I don't know if that made exact sense, but yeah, we've thought about it, and our basic, our core service hasn't changed. Family support partner, peer navigator here looks like they always have. Some of the internal practices have changed. They're not more flexible, or as flexible in their ability to respond. There's more supervision. There's more documentation of services that takes place. There's higher standard for that type of service.
Okay, are there any further questions before we close out? We have about 3 minutes left in our time. There's a question about the differences between the case manager function and the peer support role. I think that's for you, Paul.
Yeah, and
it may also be
so the case manager, was there a question I expected?
More of a program question.
And the standards. So to be fair, the program standards, there are quite a few standards that you have to meet under each category, and there's not a direct apples to apples comparison. When I was talking to Millie yesterday, Fran, about our experience, I said for AYFN, I think the best possible outcome would be to have COA look at the counseling support, case management, and family preservation standards and blend them. Remove some of the redundancy, remove some of the more stringent requirements for case managers, especially around education and formal experience. The case management requires things like there are time limits to the screening process. I'm paging through it right now because there's a lot. Time limits to the screening process that aren't so stringent in counseling support in the family support partner role. It requires that I have access to clinical staff, which we just hired an MFT here in part to help us meet that requirement. But there is a level of clinical supervision that's required for case management that's not required for the counseling support and education. And you could contract for that service, I suppose. We decided internally to hire the MFT. There is more documentation required. There's a treatment plan review required. There's a lot of different things. There's a timeline for assessment that we would normally not follow stepwise. We still provide all the pieces of the assessment that's required by COA, and we had been doing that prior to looking at accreditation, but we didn't provide it as in such a structured way. So our staff had been previously used to, our parent family support providers, our peer navigators have been previously used to doing the documentation more when it was convenient for the family. And there's timelines now that they have to meet. And that's been a big thing because that requires more supervision and it requires more oversight of staff. Sherry.
So there's one last question.
Yeah, Sherry, I see her question. It's less grassroots in the sense that the staff that we have providing the service, it's not. So when I started doing this work, Fran actually hired me, and
Are you there, Paul? Afraid we may have been disconnected.
Nope,
Nope,
I'm back. Can you hear me?
Yes.
Okay. I'm sorry. It's the last couple of days with the phones here. We're a long ways away. So our staff has to focus more of their time on documentation. Documentation is a big one. Documenting their service. The work that they provide is more technical. It's less. There's less advocacy and support. To me, the difference feels like, Fran hired me, there was a very strong alliance built through relationship with the people that we serve. And as we move forward here and become more formal, our direct service staff are beginning to feel a little bit more like the providers from the Community Behavioral Health Center. They have more, they have a different approach. And I think that part of that is happening because of the structure that we're putting in place. They have more rules that they need to consider, and they have more requirements on their time, on the freedom that they used to have. They can't make a lot of the choices that they used to make autonomously anymore. They have a supervisor that they need to run things through. I think that to give you a more pointed answer, I'd really need to think about that. To me, it's more of a general feel. It just does not have the same feel with this organization. It is definitely more formal now.
Mm-hmm. Okay. Well, we have run out of time for the webinar. I do encourage everybody to register and log on for the second part on October the 3rd. And again, I want to thank all of our presenters for not only sharing the information, but also being willing to answer questions. This copy of the presentation will be provided through the TA network. There will be an email going out. We're also going to be sending out an evaluation, very brief one. We ask everyone to please fill that out when they get it. Just take a minute. So thank you again for being with us, and have a good rest of the week.
Our pleasure. Thanks, everyone.